Why are young people increasingly getting cancer? Early onset cancer, a growing global concern. The rise in early onset cancer cases is becoming a major health concern worldwide, with significant increases reported in both the UK and the US. In the UK, cancer diagnoses among 25 to 49-year-olds surged by 24% between 1995 and 2019, according to new research from Cancer Research UK. Alarming statistics. Similarly, the U.S. has seen a troubling uptick in cancers like colorectal, pancreatic, and gastric in younger adults, raising urgent questions about the drivers behind these trends. From 2017 to 2019, approximately 100 people aged 25 to 49 were diagnosed with cancer daily in the UK. While most cancer cases still occur in individuals over 50, the growth rate in younger adults is outpacing older age groups. For example, cancer rates in over 75s rose by 10% over the same period compared to the more than double rate of increase in younger adults. In the U.S., colorectal cancer diagnoses in adults under 55 have risen from 11% in 1995 to 20% in 2019, with some cases emerging before the recommended screening age of 45. According to Dr. Scott Kopitz of MD Anderson Cancer Center, this shift in cancer epidemiology is a call to arms for better understanding and prevention. Potential causes. The rising prevalence of cancer among younger individuals stems from various factors ranging from lifestyle habits to environmental and genetic influences. 1. Unhealthy dietary habits. Unhealthy eating habits are among the leading contributors to the increasing cases of cancer in young people. Overconsumption of high-fat foods, fast food, and a lack of green vegetables are considered key factors that elevate cancer risks. Preservatives, impurities in food, and unsafe cooking methods also create favorable conditions for the development of cancer cells. 2. Lack of physical activity and staying up late. Modern life often challenges individuals to maintain an active lifestyle and regular exercise routines. Sedentary behavior combined with staying up late creates an environment that negatively impacts health. Research has shown that physical inactivity and a habit of staying up late can increase the risk of cancers, particularly colorectal, endometrial, and lung cancers. 3. Impact of technology. The rapid development of technology has also contributed to the rise in cancer cases among young people. The use of mobile phones, computers, and other electronic devices before bedtime can reduce sleep quality and increase cancer risks. Moreover, radiation and pollution from electronic devices can cause health issues, including cancer. 4. Environmental pollution. Air and water pollution play significant roles in the increasing cancer rates among younger age groups. Fine dust and ultrafine particles in the air can cause respiratory inflammation and elevate the risk of lung cancer. 5. Contaminated food and harmful chemicals. Consuming contaminated food containing harmful chemicals, excessive antibiotics, bacteria, and mold can negatively affect health, including increasing cancer risks. 6. Early sexual activity. Early sexual activity may lead to HPV infections, a virus that can cause various types of cancer, including cervical cancer, anal cancer, and throat cancer. Advances in diagnostics, genetics, and microbiome research are also under investigation. However, many young patients diagnosed with cancers like colorectal cancer have no family history or genetic predisposition, leaving researchers to explore less obvious causes. There has been a clear rise in cancer incidence among young adults in recent decades, said Professor Charles Swanton, chief clinician at Cancer Research UK. It's a complex puzzle that urgently needs answers. Dr. Ahmed Njemel of the American Cancer Society emphasized the importance of increasing awareness and early detection. He advocates for greater uptake of non-invasive screening methods, especially for those aged 45 to 49, as well as for high-risk individuals under 45 with family histories or genetic predispositions. Ongoing research and prevention. Efforts to address early-onset cancer are intensifying. Team Prospect, funded by Cancer Grand Challenges, is working to uncover the biological and environmental drivers behind this trend. Dr. Aparna Parikh, a Harvard Medical School professor and Prospect researcher, stressed the importance of global collaboration. By studying diverse data and patients worldwide, we aim to identify high-risk individuals and develop prevention strategies to shape a healthier future for younger generations, she said. Despite these challenges, there is hope. Advances in treatments and early detection have contributed to a 33% decline in cancer mortality in the U.S. since 1991. However, disparities remain, with Black and Native American populations facing higher mortality rates for several cancer types. Prevention remains a critical tool. Around 40% of cancers are preventable through lifestyle changes. Not smoking, maintaining a healthy weight, practicing sun safety, and reducing alcohol intake can significantly lower risk, Swanton explained. Looking ahead, as scientists race to unravel the mystery of rising early-onset cancers, increasing investment in research, prevention, and equitable access to care is essential. While the incidence of certain cancers continues to climb, the potential to reverse these trends lies in early intervention, awareness, and a collective commitment to combating this growing health crisis. Many studies suggest that a healthy diet rich in nutrients and cancer-fighting foods can reduce the risk of cancer and improve treatment outcomes. What to eat to combat cancer cells? This is a common question, especially given the rise in cancer due to long-term consumption of food and drinks containing chemicals. Below is a summary of cancer-preventing foods compiled from reliable sources. 1. Cruciferous vegetables. Includes broccoli, cabbage, and spinach, rich in antioxidants and anti-inflammatory compounds like sulforaphane and indole-3-carbonyl, known to inhibit cancer cell growth. 2. Berries. Raspberries, blueberries, strawberries, and pomegranates are high in antioxidants, such as anthocyanins and flavonoids, which help reduce cancer risks like breast, colon, and liver cancers. 3. Tomatoes. Rich in lycopene, they help prevent prostate, breast, and colon cancers. 4. Legumes. Beans and lentils are excellent for reducing colorectal cancer risks due to their fiber and nutrient content. 5. Nuts and seeds. Flax seeds, walnuts, and almonds contain beneficial compounds that may help prevent cancers like breast and prostate cancer. 6. Whole grains. Barley, brown rice, and oats support gut health and reduce risks of colorectal and breast cancers. 7. Fatty fish. Salmon, tuna, and mackerel are rich in omega-3 fatty acids, which may lower risks of breast, colon, and prostate cancers. 8. Turmeric. Contains curcumin, which has anti-inflammatory and antioxidant properties beneficial in cancer prevention. 9. Garlic. Rich in allicin, which boosts immune defense against cancer. 10. Carrots. Linked to reduced risks of gastric and breast cancers. 11. Olive oil. Helps lower risks of breast and colorectal cancers and offers cardiovascular benefits. 12. Cinnamon. Shown to inhibit cancer cell growth and support overall health. 13. Citrus fruits. Oranges, lemons, and grapefruits protect against colon, breast, and liver cancers with their antioxidants. Additional tips for cancer prevention. 1. Exercise regularly. Whether it's running, swimming, yoga, or cycling, regular physical activity is highly beneficial for your health. Exercise strengthens the immune system and reduces the chances of cancer recurrence. For cancer patients, particularly those undergoing radiation therapy, appropriate exercise can accelerate recovery of blood-forming functions, enhance immune cell activity, and improve overall resistance to disease. Additionally, exercise helps prevent osteoporosis and reduces the risk of complications such as strokes. Consistent and moderate exercise has been shown to reduce the recurrence and spread of lung cancer while significantly improving physical fitness and quality of life. Choose activities suited to your physical condition and avoid high-intensity workouts. 2. Maintain a positive outlook. Optimistic individuals have lower cancer recurrence rates and enjoy longer lifespans. Feelings like anxiety, depression, stress, fear, and pessimism are common among cancer patients, but emotional health is closely linked to cancer progression, metastasis, and prognosis. Clinical studies have shown that patients with a positive mindset and an optimistic outlook have lower recurrence rates and longer survival times. On the other hand, pessimistic or depressed patients face higher recurrence rates and shorter lifespans. Depression significantly hampers treatment and recovery, making emotional well-being critical in combating cancer. 3. Get enough sleep. Adequate sleep boosts the immune system by activating T cells. Research shows that individuals who sleep well have higher T-cell activation levels than those who don't. Sleep disorders are common in cancer patients, often caused by surgical pain or negative emotions. Regardless of your health status, improving sleep quality is essential. Aim to maintain a consistent sleep schedule, avoid electronic devices before bed, refrain from heavy meals or caffeine consumption, and consider relaxation techniques like meditation or reading. 4. Get sunlight safely. Vitamin D obtained from sunlight can slow the progression of precancerous cells to cancer and help control cancer cell growth. For lung cancer patients, vitamin D reduces the risk of mortality and prevents severe side effects during immunotherapy. Expose yourself to sunlight for about 10 minutes daily, but avoid peak hours and excessive exposure. 5. Eat a healthy diet. Balanced nutrition is key to reducing cancer risk. While indulgent meals like fried chicken, barbecue, and hot pots may be tempting, excessive consumption can lead to weight gain and increase cancer recurrence or metastasis risks. Studies show that obesity from high-fat diets supports tumor growth and weakens the body's immune response. Focus on balanced nutrition, adequate protein intake, and a varied diet to maintain health and resilience. 6. Maintain a healthy weight. Research indicates that obesity significantly increases cancer recurrence rates. Obese women, for example, have an 88% higher risk of dying from cancer than those with normal weight. Maintaining a healthy weight through a balanced diet and regular exercise can significantly reduce your cancer risk. 7. Limit exposure to radiation. While CT scans are useful for detecting tumors early, excessive scans within a short period can be harmful. According to the World Health Organization, radiation exposure should not exceed 5 mSv annually. Balance the benefits of medical imaging with potential risks by following professional recommendations. 8. Avoid tobacco and alcohol. Tobacco, nicotine, and other chemicals in cigarettes are major causes of cancer, particularly affecting the respiratory system. Alcohol. Excessive alcohol consumption irritates the gastrointestinal lining and burdens the liver, increasing the risk of liver and digestive cancers. Limiting or quitting these habits significantly reduces cancer risks. 9. Schedule regular health checkups. Cancer develops over a long period but can progress rapidly due to factors like diet and lifestyle. Early detection is critical for effective treatment. Doctors recommend regular follow-up checkups every 3 to 6 months within the first 2 years after cancer treatment and annual checkups after 5 years. Routine screenings can detect hidden cancer cells early, preventing recurrence and metastasis. 10. Ensure proper ventilation while cooking. Poor ventilation in kitchens can increase cancer risk. Studies reveal that fumes from cooking oil can be as harmful as smoking 96 cigarettes in a poorly ventilated office for 6 hours. To minimize risk, avoid overheating oil while cooking. Use range hoods and ensure proper maintenance. Keep your kitchen well ventilated and regularly clean ventilation systems. By adopting these lifestyle habits, you can effectively reduce your cancer risk and improve overall health. If you enjoyed this video, hit the like button and subscribe to our channel for more informative videos like this one. Thanks for watching.